everyone, welcome back to doctors.com. My name is Sangya Lakhanpal and I am your host for the live question answer session. I have to say, it is so good to be back, and that too with one of our favorite doctors, Dr. Amisha Mahajan. Welcome, doctor.
Thank you.
How are you doing?
I'm good. How are you?
I am very good. You're looking very beautiful today.
Thank you so much. You too, as
And
always.
thank you. Thank you. I wanted to ask you, how is this time after, like, post lockdown treating you and, like, doctors in general, like the scene of dermatology in specific? How's that going post lockdown?
Actually, it's going really nice if we talk specifically about dermatology because people have become so much more aware about themselves, their bodies, their mind, their skin. So, अब तक जो लोग ऐसे भी थे that we don't have time to take care of our skins. I've seen that even they are more interested to, devote that time to a better skin and general body in general. So, yes.
That's amazing. So I want to tell the viewers why I specifically asked about dermatology is because Dr. Amisha Mahajan is a well-renowned dermatologist. And before we go any further, I would love to tell my viewers about you and your long list of associations and accomplishments. So just bear with me. Guys, I want to tell you that she is a cosmetic dermatologist who specializes in skincare, aesthetics, and skin disorders. Her areas of expertise are lasers, Botox, fillers, and threads. Of course, she will tell us a lot more about all of these things once we start chatting. And she has trained many dermats for these aesthetic procedures and is a speaker at aesthetic conferences. She has authored chapters in books and has many publications in international and national journals. Recently, her work on using lasers safely during COVID 19 was published in the Journal of American Academy of Dermatology. Congratulations on that, doctor.
Thank you so much.
She is also a member of many renowned associations such as Indian Association of Dermatologists, International Women's Dermatology Association, Cosmetic Dermatology Society of India, and Skin of Color Society of USA. Now, last but not the least, she has trained with some of the pioneers of cosmetic dermatology in India and USA. So, I just want to clap for you. How does it feel at such a young age to have so many accomplishments and associations, and that too successfully all over the world?
I think when you're passionate about something, so you really work hard for it. And dermatology is something I'm so passionate about. I can talk about dermatology for hours together. And yeah, so
That's amazing. And I am so excited because it's such a pleasure talking to you all the time. Last time we spoke on plethora of topics related to skin and hair. But today, our viewers sort of showed interest and curiosity on one specific topic. And since you are so good at it, because I will let out the secret, Dr. Amisha is also my dermat, guys. So I know how amazing she is at certain procedures. So this specific procedure I want to talk to you about is lasers today. Let's focus on that because we have a lot of curiosity around this and in general as well. But before we get into the explanation, I would just like you to briefly touch upon what exactly is a laser treatment, but don't tell me what it treats because we'll play a little game in regards to that. So if you can just tell
okay,
me
done.
what is laser treatment briefly.
So laser is basically a form of light, and we have light. There are a lot of lasers. There are different lasers for different things. So we see what we want to accomplish with a particular laser, and then every
Okay.
laser is a different wavelength. So every laser is meant for a different purpose, and that's what it does. I think sometimes people get a bit scared also when they hear the term laser, ki pata nahi kya hai, but it's more just like a light being used at a specific wavelength to treat some specific, things like hair or scars, whatever we are dealing with.
All right. Now that you have mentioned a few conditions and situations where lasers can be used, we'll still play the game. The game is called effective or not effective. For effective, you'll
Okay.
do thumbs up, and for not effective, you're going to do thumbs down. And I'm going to take the names of few conditions that can or cannot be treated by lasers. So, are
Okay.
you ready? And this has to be quick, without
Totally. Okay,
explanations.
done.
Okay? Okay.
Done.
Hair
Done.
removal, effective. Scar removal,
Totally effective.
okay. Tattoo removal,
Effective.
okay. Pigmentation,
Effective.
wow. Birthmark,
Effective.
wrinkles,
Uh, Effective, but not as much as Botox and fillers. Yeah. So
okay.
good, but there are better options also. So it depends what you're treating.
Okay. Stretch marks,
Effective.
moles.
Effective.
Game is over, and I'm so glad we picked this topic because it seems like laser works for everything, doesn't it?
Everything. Everything.
Okay.
Totally.
All right. Perfect. So now that you've played this game with me, and we know that it's super effective, and the first topic we touched upon was hair removal, most of the times laser is discussed in regards to hair removal other than
Yes.
of course the other things.
Other
So
things.
how
Yes.
about you tell us about hair removal and laser and how it's done and all of the good things.
So, laser, like I said, we pick different wavelengths for what we are trying to accomplish. So, when it comes to hair removal, what we are trying to target is hair, and the laser targets melanin specifically in the hair, right? So, that's what we call in our language the target chromophore. So, the laser it targets the chromophore, which is the melanin, which gives you the black color to the hair, the pigment. So, laser targets that, and we do sittings for the laser, and with each session you see a good change in the hair. You have a good drastic reduction in the hair. So that's what the hair removal laser is about. A lot of people ask that, is it permanent? So because your body keeps making hair, so laser hair removal is like you've got to do some sessions and you're all sorted.
Okay. I'm going to interrupt you because I have another game for you specifically related to laser hair removal. And this is a yes or
Okay.
a no game. Okay. Before you
Okay.
let out all the secrets, let's play this game. It's a yes or a no. And I will ask you certain myths or thoughts related to hair removal when it comes to laser. And please say yes or no.
Okay.
The first
Okay.
one is 100% hair removal.
No.
Very painful.
No.
Safe.
Yes.
Safe for patients with skin conditions like vitiligo or rosacea or eczema.
If done under a dermatologist, yes.
Okay. Um, Hair growth is softer post laser hair removal, if
100%
any.
yes.
Okay. Maintenance is a must post laser hair
And
removal.
yes. Big
Okay.
yes.
Okay. Leaves a dark patch behind.
No.
Okay. Leaves the skin absolutely smooth.
Quite smooth?
Okay. Helps get rid of ingrowths and scars
Yes.
caused by.
100%. 100%. 100%.
Okay, lovely. So that was the game. We're done with it. Now you can explain all of these things at length and extensively if you wish.
Yeah. So the hair removal laser, like I said, it needs sessions. What it is actually laser hair reduction. So we can achieve a good reduction with it. The reduction could be around 80% also. But you always need maintenance sessions. Let's say if you're done with your 8 to 12 sessions, after that, you might need maintenance once a year, or somebody, depending on their growth, might need it 3 times a year. So it really is very dependent on how your skin behaves to laser, right? And there's no dark patches after the laser if you're doing it under a dermatologist and who understands your skin, and does the settings according to your skin. I don't think dark patches is ever a problem with laser. So yes, so those are the things you can do. And if you have a skin condition, like you said, like rosacea or eczema, you never do it on the active condition. What that means is that if I have an inflammatory condition here, I'm not going to do the laser while the disease is active. But let's say you have an eczema, it doesn't mean you cannot undergo your laser sessions, because if somebody says, doc, I get eczema, I don't have it right now, but I get eczema, so you can totally do it. That's not an issue at all. And
Since you
yes,
mentioned,
and you just do a few sessions
I'm sorry, go ahead, please.
and then you're done. Yeah, you just do
Okay.
a few sessions and then you're done. So there are two things. There's like a face hair laser and there's a body laser. So when you're dealing with face laser, especially chin area, or some people have hard growth on the face here, that kind of a growth is usually because of a hormonal imbalance. So in those cases, we also have to assess that what's going wrong in your body. Laser can only target the hair. It cannot correct your body. It cannot, it can neither correct it nor can it make it worse. So
Hmm.
you have to side by side take care of your hormonal imbalance either through lifestyle modification or through some medicines. That is an individual case that you have to assess why do you have it and how to correct it. But sometimes, I see a lot of people having that notion that, oh, mere baal fir se aa gaye. But are you seeing that is your body hormonally, in the right situation? Because if
Hmm.
that is, then your body's not going to make any more new hair, right? So that's how it goes.
Absolutely. Okay, one question that we received, like you said, that when we perform or when you perform laser for hair removal, it sort of focuses on the melanin in the hair
Hair,
follicle. So,
which is the pigment cell.
yes. So now people with vitiligo, how, like, can they get this treatment done or not?
So it depends where you have vitiligo. Let's say you have a
Okay.
patch of vitiligo at a place. So, and if the hair is white on that you cannot target with laser, right? That you have to correct. You have to correct the vitiligo
Hmm.
part, that कि आपका vitiligo ठीक हो जाए and you pigment again. So that is the thing. But let's say if you have a
Huh.
vitiligo patch here, you still have melanin in the rest of your hair, so you can go about your hair removal as such. But yes, if the
Lovely.
question is can we target white hair with melanin, we can, with laser, sorry, we cannot. Sometimes we
Hmm.
get ladies in old age who have this white dense growth, then we have to do electrolysis for them. Laser does not work on white hair, if that is the question. But if
Oh,
somebody has
wow.
vitiligo and the vitiligo patch is somewhere else, then you can definitely do laser for the black hair on the body or the face. That is possible. But white hair needs electrolysis.
That's something new we just learned. Another thing
Yeah.
is, can you please also touch upon the pain factor during laser hair removal? You said not at all, so can you please elaborate?
So, see, pain is something which is more like subjective. How do you feel it? So, we have technologies which are coming up which are very, very less painful. So, initially, also, if the pain was there, we could decrease it with the help of numbing creams or, just reducing the energy. And now, as the technology is progressing, we have painless lasers also coming up, which are very, very comfortable. So,
Lovely. So, can you also please tell us what exactly is maintenance? We did discuss it that we need it, but what does maintenance mean after hair removal?
so maintenance means, let's say you've done 8 sessions, right? Now your hair growth is not coming for, let's say, it's not coming for 3 months, 4 months, and then you get some hair growth. Maintenance is different from regular sessions because when you're starting your sessions, you usually will have some thicker hair growth that you're coming in for. Or if you do a waxing or a threading, they're going to come back every 20 days. Maintenance means that you've done enough sessions of laser that your hair growth has become very slow and very fine. So you have a good hair free period, like, 3 months, 4 months in which you don't have hair. And even if you do, they're never like your growth in the starting. They're
Original.
much less. Yes, they're going to be like at least 50-60% less. There are cases who have it like 80% less. So
Oh,
that
wow.
depends.
Okay.
Yeah.
Thank you so much. Now, there's this Insta trend going on with lasers for pigmentation, and we have a related live question from Shaina Atwal about the same. Hi, doctor. What do you do in case of black pigmentation on face?
So
So, your thoughts
pigmentation
about this?
is,
Yeah.
yeah. So pigmentation is a lot of types. So one is if you're dealing with freckles. One is if you have a brown patch here, which is like melasma, or one is just having uneven texture. So,
Okay.
first, let's start with uneven texture. With uneven texture, you can definitely do lasers, and it really helps, right? And then you protect it with the help of sunscreens and some depigmenting creams. I also see this question coming for black pigmentation. Medicines also work, or only laser would work? Yes. So that is very important that what I do in my practice is I first start with a regime, a skincare regime, which is right for your skin type and your pigmentation. Lasers is
All right.
something, um, it's like if you're going to walk from Amritsar to Delhi, so one is you walk, and the second is you take a plane to go, right? So that is the difference. Laser, it doesn't mean like you'll never reach Delhi if you go by car, right?
Ah.
When you take the plane, you just reach quicker. So lasers are to increase your results. But it is also important to have a good skincare regime that you're protecting and preserving the results that you get. Now, coming to types of pigmentation, for uneven pigmentation, lasers work beautifully. For freckles, lasers work wonderfully well. Like people ask me that once I get the freckle laser done, like, will they come back again? They can, because they can, or I should say they will, because that's your skin's tendency to UV exposure. So you
Ah.
have to be very, very good with your sunscreen game, which has to be minimum 2 to 3 times a day. Some depigmenting creams that has to go on, because it's not a disease. It's not like an infection that you have कि हमने किया ठीक और दोबारा नहीं होगा अब, right? So it's skin is a continuous process. You have to take care of it. Then coming to one condition which is known as melasma, which is you get it here. There are girls who get it in a younger age. There are girls who get it after pregnancy. Men also get it. So for that, again, laser works, but taking care with the help of medicines and some other treatments helps more in melasma than just doing the laser. Laser we reserve in melasma only for cases who are not responding to the medical line of treatment.
All right. So to answer this person's question, basically, medicines would be walking to Delhi and laser would be taking a plane to Delhi, correct?
Yes, yes.
That's such a beautiful analogy. Lovely. We have another question, and please give some idea also how much it costs for pigmentation.
So costing is going to depend on what treatment we are doing, what laser we are using, what is the type of pigmentation. I think that needs a proper assessment. But if you just want an idea, it can anywhere cost from 3,000 to 8 to 10,000, depending what is the laser, what is the concern, and also how many number of sittings you're looking at. So that is something very individualized.
Yeah, guys, so don't forget to click on the link in the description box to schedule an appointment with Dr. Amisha. I'm telling you, she's amazing. She's my dermat, in case any of you that have joined recently. So, yeah, she's fabulous, and they're taking amazing care in terms of sanitization and all at RM Aesthetics. So, yeah, good job on that, doctor, and thank you
Thank
also.
you.
Yes, another question from Shaina. Shaina, thank you for being so interactive. There is a myth that there is no solution for pores. Is it so?
So there is. So pores are, they're dynamic. If you say, I do something to the pores and I'm done for the rest of the year, it doesn't work like that. So to start with, I start with some pore refining creams. They help in camouflaging it a bit. But in terms of procedures, if we want to do, there's the two procedures that I love for pores. One is mesotherapy, that we do at the clinic, and there's another procedure which is known as mesobotox. The mesobotox gives you that poreless skin, and those results they last approximately 1.5 to 2 months. So, and after that, you can just take care of the skin. In younger age, pores are usually in oily skin types, and when you reach, in the older age group, or I should say the middle-aged age group, they're usually because of sun damage that your skin structure becomes weak. We call it in our language solar elastosis happens, and because of that, the skin structure becomes weak, and you see the pores they shine through more, even if you have a dry skin because of not
Okay.
taking care. Yeah.
All right. Thank you. So, Sunil Sood, I hope I'm pronouncing this right. I have psoriasis. Can you suggest good way to get rid using homeopathy medicine?
Hi, Sunil. So I'm a dermatologist. I'm a MD dermatologist qualified in dermatology. I don't know anything about homeopathy medicine. So if you're looking for homeopathy medicine, I think somebody specializing in that field can help you more.
Yeah. All right. So, next question. I want to talk a little about tattoo removal through laser. So, can you please elaborate on that and what is it a painful process or what all is
Yes.
involved?
Is it
It
painful?
is?
Yes. Yeah. So
Okay.
as painful as getting your tattoo done. And also, it needs more sittings. It's always best to be sure before getting yourself inked. Getting yourself inked doesn't, when you see on YouTube some videos, it's like gone. The tattoo just goes away when you're doing the laser. It's just the air bubbles that come on the skin surface and they're gone in 20 minutes. When we do the laser, it takes approximately 20 days or 1 month for you to see the results with the tattoo removal. And you can need sittings for that. If it is an amateur tattoo, you need, 4 to 6 or 4 to 8 sittings, depending on what type of tattoo you have. For professional tattoos, you can need even more than 10 sittings sometimes for it to go 100% completely.
Oh,
So,
wow.
uh, most of the people, we get a lot of people at RM Aesthetics for tattoo removal, especially because of job purposes. So I'll tell you, one is job purpose, one is, if you have a name written which you don't want that to be inked on your body. When it's a name written, we do the surgical treatment because we don't want any shadowing. Because even after the tattoo removal, you can have like a 2-3% shadowing effect, which completely works if you're looking for a job because nobody will notice it. But yes, if it's a name written, it's preferable to go for the surgical option.
Do people come in who accidentally got a tattoo done on like a drunken night or under the influence? Has that happened ever?
Um,
Or does that only happen in movies?
no, I've never had somebody who's got it done under influence, but I've had cases in which poor thing. I remember एक बंदे ने tattoo वाले ने नाम spelling उल्ट alphabets ऊपर नीचे कर दिए, and the person was like, oh shit, like
Oh.
like ES करना है तो SE कर दिया, something like that happened. Uh, and tattoo removal takes time, it's not like you come in and you're
Uh,
done.
well, Shaina has good news. She's already scheduled an appointment with you for tomorrow at 5 p.m. So, and she's, of course, saying thank you and we'll see you tomorrow. So,
Yeah,
yeah.
sure, we'll talk more in detail about your pigmentation then.
Yes, and you're welcome. You're most welcome. I'm glad you will not be disappointed. I'm telling you, Dr. Misha, at all. All right. So next, I want to speak about is scars. A lot of people want to get rid of their scars, and you mentioned that laser works for that as well. So I would really, really want you to explain that procedure, please.
So scar removal is something that is so close to my heart. I do a lot of scar removals, and whenever somebody comes to the clinic, we assess every scar in a way that what is going to benefit this kind of scar more. So either the plastic surgery procedure or the laser procedure, because every scar needs a customized solution. Uh, Sometimes we do the surgery first, then further we lighten it with the help of lasers. In some cases, we go ahead with the laser itself. So we get different type of scars. Sometimes they're burn scars, keloid scars, accident scars.
Wow.
Stretch marks are also a kind of scar, and so it is very very heartening to get results in scars. One thing I always tell my patients is once a scar is always a scar. So जो भगवान ने स्किन दी है वो कोई डॉक्टर नहीं बना सकता, बट हम लेजर से आपके स्कार को लाइटन कर सकते हैं. And also I see people feel much better when the scars are lighter. Usually if there's somebody with a scar on their face and they're questioned so much about it, ये क्या हुआ, and sometimes it can be because of an accident or a surgery, and you don't want to live it again, when somebody's asking you about it. So I have seen scars is probably the most gratifying procedures for me because it changes people's lives.
How lovely and how sweet. Okay, so can you also please help us with in terms of birthmarks and the removal of birthmarks through laser?
Yeah, so a lot of people have misconception that birthmarks cannot be removed. So birthmarks are of different types. They can be black, they can be red, and more than birthmarks, I would like to talk about nevus. So कुछ birthmarks ऐसे हैं जिन्हें हम congenital बोलते हैं, which means they are by birth. There's some
Okay.
nevus. पंजाबी में हम लसन बोलते हैं nevus को.
Okay.
So a lot of people say कि it was not by birth, but it sometimes they develop after some years, maybe around 10 years, 13 years. So there are different types of birthmarks, or I should say nevus, which are there. A lot of them, they can be helped with the help of lasers, and some of the birthmarks, they require surgical treatment. So again, we assess that what is the best way to go about it. Is it a brown birthmark? Is it a red birthmark? Because every birthmark requires a different laser, and then accordingly we treat that patient. And birthmarks
So,
usually require more sittings. So if you're just dealing with pigmentation generally, if I'm talking of, let's say, 4 to 6 sittings, when I'm dealing with birthmarks, I might be needing sittings more than 10 also sometimes. But that depends. That's very individual according to the birthmark.
so in comparison to tattoo removal and birthmark removal, which one would need more sittings?
It depends again that what is the type. For example, when you're dealing with a tattoo, there are a lot of factors which determine the number of sittings. उस tattoo में कितनी ink गई है, कितनी depth पे needle गई थी, और उस जगह पे उसने कितनी ink deposit करी. Sometimes I give an estimate कि अच्छा we are looking at 5 to 6 sessions, and I have seen कि if the tattoo is more superficial, the results come in 4 sittings also, right? So it's very individualized, and also the type of ink matters in tattoo removal. अगर एक हल्की क्वालिटी की इंक डली हुई है तो वो जल्दी जाएगी, एंड अगर एक बहुत ही अच्छी क्वालिटी की इंक डली हुई है तो इट विल नीड मोर सेशंस.
Okay. I also wanted to know, it skipped my mind for the tattoo removal process. Does it matter how recent the tattoo was?
Ideally it should be done after a gap, because the tattoo has to be set. If it is done after, because when you do the tattoo there is still some amount of inflammation even if you can't see it. So sometimes it is technically, or I should say ideally, we should do it after a year of
Oh, okay.
the tattoo being made. Yes.
Okay, but does it matter like if someone comes in after a year and someone's come in after 5 years of getting a tattoo done, is it harder if it's been on your body for longer?
No.
Does that
If it's
matter?
been
Okay.
like 5 year, no, if it's a 5 year old or a 10-year-old tattoo, sometimes it is easier because the extra ink is removed by the body over time. So whenever you get a tattoo done, over the years it gets lighter. And if it is not getting, a bit lighter over the years, it means ink बहुत ही अच्छी quality की है, and laser से वो मुश्किल ही होने वाली है निकालनी.
भूल जाओ. All right, lovely. We have another live question. It's from Afareen Khan. Is there any disadvantage of taking glutathione? Can you
IV.
help me, please? Yeah, that.
Yeah, glutathione IV drip. Yeah.
Yeah, Thion IV.
So
Thanks.
So glutathione is basically a very strong antioxidant. It helps in skin lightening. It
Oh,
works at the melanin pathway, and there are no side effects of using a glutathione drip, but they should always be done under, under a doctor, under a dermatologist. They should not be taken just like that. So recently, I'll tell you about this. Uh, I had a case where the glutathione drip was given at a salon without any doctor, and that patient,
oh boy.
came to us after a few days, and she told that she had to further get hospitalized because of that. So
Oh.
see, if you're taking something which is IV, it has to be under supervision. Glutathione drip से कुछ नहीं होता है. अगर हमें let's say 10,000 बंदे में एक बंदे को कोई कॉम्प्लिकेशन आनी है, so when you're under a dermatologist we see it right in front of us and it is stopped. So nothing's gonna happen, but that doesn't mean you can still just get the glutathione and get the IV drip yourself or without supervision just because it's safe.
I sometimes feel like we forget that skin is the largest organ that we have, and it is the most exposed and probably the most sensitive, and we should consult a dermat when it comes to all these things and not experiment with over the counter, or just take the easy way out. And I think we need to really, really remember that. And just for basic skincare also, isn't it imperative to go see a dermat at least in the beginning, so you know what you're doing, right or wrong, at least, right?
I, I totally agree to that. I sometimes see people struggling with such high expensive products also, and they're like, Doctor, nothing suits me. I think it's when you're not using the right product according to your skin. So I get these people with dry skin and pimples on their face who are using a neem face wash and a heavy moisturizer. So the right thing for them is to use a mild cleanser and a moisturizer which is meant for acne prone skin. So I think sometimes the mistakes are so gross in the skincare that it's always better to consult. But apart from that, I personally feel that even if your skin is normal and you're just going about your day with a normal skincare routine through over the counter products, that is still acceptable. But going for skin treatments, lasers, IV treatments without the guidance of a dermatologist, I think that is something you should not do.
आई थिंक सबसे बड़ी प्रॉब्लम ये है दैट वी थिंक कि अरे डॉक्टर के पास जाना है, कंसल्टेशन देनी पड़ेगी, बट देन वी फॉरगेट व्हेन वी आर वेस्टिंग हंड्रेड्स एंड थाउजेंड्स ऑन प्रोडक्ट्स एंड एक्सपेरिमेंटिंग. तो वहां गड़बड़ हो जाती है थोड़ी. आई थिंक इट्स जस्ट द माइंडसेट. एंड दूसरा, आई वांट टू थैंक यू फॉर फिक्सिंग माय स्टेप्स ऑफ प्रॉपर स्किन केयर, अदरवाइज आई वुड हैव हैड अ मेस्ड अप स्किन लॉन्ग टाइम बैक. सो थैंक यू फॉर दैट. लाइक आई सेड गाइस, शी इज
My pleasure.
अमेजिंग. But
You are
last
amazing
topic.
too.
Thank you. I guess I'm just obedient. Let's say that. But the last question that I have regarding lasers is about anti aging through laser. Is it possible, and what is involved?
Yeah. So there are many factors to aging, that we need to consider. One is skin. So our skin quality looks wrinkled, or just the texture is not right. When you think there's a hydrated plump skin and there's a very dehydrated sort of a skin. So that is one factor. The second factor is sag. As tend to age, you'll notice that your skin comes down, so that when you do like this, your skin suddenly looks a bit better, or you start noticing some jowls here, or deflation here, or the fat coming here instead of the high cheekbones. So these are two main factors which are there in aging. So with the help of lasers, we can definitely make the skin quality better. If there is any unevenness in skin, sunspots, age spots coming on the skin, we can make them better with the help of laser. So in terms of skin quality, we can work with the help of lasers. When you're dealing with the lifting part, the sag part, that needs some other things. Like we can lift it with the if you're looking at machines, we call them energy based devices. There's something known as HIFU, which helps in tightening the SMAS layer of the skin. That's number one. That's just why a machine doesn't require any injections. It's a very comfortable procedure. So that is the one thing that can be done. It's completely painless, right? Other thing is we can use threads. So in threads, we use threads, and depending on what area we are targeting or full face that we are targeting. So mostly you see these lines and these lines. So we lift the skin with the help of threads, and again with the fillers, we help the structural component of the face to become better. If you're doing in a younger age, we are looking at a better contour of the face, trying to make the face look more attractive. I'm sure you've seen, these actresses have these beautiful jawlines, and you're like, iska bone structure bahut acha hai, right? And that comes from fillers, because fillers are, and if you
Oh,
look at
wow.
the old pictures, you're like कि इसका bone structure अब अच्छा हो गया. Bone structure नहीं अच्छा हो गया. They've had there's a dermatologist behind that good bone structure there.
From
And
that round face to a nice jawline.
chiseled face,
Yeah,
yes.
chiseled
And
face. Yeah.
I've also seen that these procedures, they get a bad name because when you're looking at a bad result, or I'll say overdone result, you'll definitely notice there's something wrong with her. I don't want to look like this. This looks too
Yeah.
plasticky. But you see these beautiful faces all around you. be it on TV or just people around you, and you don't even get to know that they've done a procedure. These procedures are, I think, very, very natural looking. It's just the natural looking results you never see because they're so natural. You don't know they've got it done. It's only the few cases that are botched up cases that you can see it. Okay, this doesn't look natural, right?
Because
So you
those are
have
the
to
ones
always
that
maintain the
garner
facial
most
harmony.
attention, na? That's why I
Yes,
think जहाँ गड़बड़ हो
yes,
जाती है वही दिखता है.
yes.
हाँ जी.
तो वो चीज दिखती है. And coming to another procedure, which is one of my favorites, is Botox. So some people get smile lines here, anger lines here, and forehead lines here. So these lines, the only thing that works for them is Botox. So what Botox does is it just relaxes the muscle. Over time इन muscles को use कर करके जो इसके ऊपर lines आती हैं, जो skin movement होती है muscle के ऊपर, वो हमें दिखती है. हम simply muscle को relax कर देते हैं, and then you get, you're off wrinkles just after the results start showing in 2 to 3 days, and you get the
Oh,
full
wow.
result in 15 days, and the result stays anywhere from 3 months to 6 months depending on your body's metabolism.
Oh, lovely. Thank you
Yeah.
so much. You have made us feel very pretty just by talking about all these procedures, and you have, I guess, made the world or the prettiness in the world seem more accessible. So, guys, if you want those chiseled jawlines or perfect skin or perfect, I mean, hair removal and smooth skin, then you know where to go to Dr. Amisha. Please consult with her. And I also want to tell you that she's extremely active on social media. So do check her out on Instagram, especially. She puts out very interactive and informative videos. You can learn a lot about yourself and conditions and procedures. So, yes, and thank you so much, Doctor, for being with us. Viewers, thank you for being
Thank
so
you.
interactive. And it's always a pleasure having you on Doctors. And guys, share this interview with whoever you think will benefit from all this information. I'm sure there are lots of people curious about lasers, so make sure you share this interview. And Doctor, I can't wait to have you back on doctors.com with something more interesting. Let me find something out and invite you back. Thank you for today. Thank you so much.
My pleasure. Okay,
Bye
bye
bye.
bye.
Take care. Bye.
Bye.